Hello, Mari Saluda here. Today we want to talk about 5 tips to lower stress and anxiety. Before we get into the tips though, we want to explain just a little bit about the physiological response of stress and anxiety. So I'm going to have Sal go ahead and talk about that for a little bit.
Hi everyone. All right, so yes, what is stress and anxiety? So stress and anxiety, basically, the simplest terms that I can think of is a physiological response to perceived threat or to an unpleasant stimulus in the environment. So what's all that science mumbo jumbo really mean? So a lot of people experience stress and anxiety in different ways, but basically what I'm talking about is when you feel something. A lot of people feel pain in the chest, feel like their heart's racing, beating really fast. Some also experience it in the stomach, like a tightening or cramping up, like a heaviness, or just kind of a general sense that things are not going well for them, things are off, feeling very on edge, nervous, worried, or this sense of impending doom, like they may be dying or the whole world is ending. And it can be very scary, and if people are experiencing this and not really sure what's causing it or why they're having these feelings. So basically what's going on is in your body there's 2 parts of the autonomic nervous system. So those for those of us without a medical degree or health background, the autonomic nervous system is part of the nervous system that's beyond our awareness. It happens involuntarily, without our control. We don't have to think about it, it's just happening. And there's 2 main parts. So there's the parasympathetic and the sympathetic nervous system. So the sympathetic is also known as the fight or flight response, and that's in a situation where there's some sort of danger in the environment, and you feel like you either have to take action or get out of there. And so that's kind of the body's alarm system for something dangerous in the environment. Now, when we're talking about the normal day-to-day stress and anxiety, that's the nervous part of the nervous system that we're not really aware of, that we're not knowing what's going on, but it's our body's alarm system telling us to get out of there or to prepare to fight for our lives. And that's what stress and anxiety basically is that body's response that we're not aware of, that we're not thinking about, but it can be to situations or stimuli or different things in our environment that actually aren't going to hurt us or kill us or are not a serious life-threatening event. They can be, but it can also be just to a social situation or
taking
a test or some job if you have to give a speech at work in front of people if you're uncomfortable public speaking, driving in traffic, someone cuts you off, you get that feeling. So a lot of different things can happen in our day-to-day lives where stress and anxiety is just a part of it, but it can cross over to a point where it affects our ability to really lead happy and healthy lives and interfere with relationships, interfere with our ability to work, interfere with other parts of our lives that decreases the quality of life, and then that can lead to a disorder, like an anxiety disorder.
Right, so just to clarify, the difference between stress and anxiety really quick, I see them used interchangeably all of the time. They are a little bit different though, so how I understand the difference between stress and anxiety, stress, you can kind of pinpoint where those nervous feelings are coming from. So for example, if it's a test, if it's some sort of a social situation, you can pinpoint where those feelings are coming from. But with anxiety, it's more of kind of a sense of impeding doom. It's not necessarily known where that's coming from. That's how I understand it, as well as chronic stress over time essentially change the brain structure and can change into anxiety. Is that?
So yeah, if I could just summarize what Mari said there. Basically, with stress, there is like a known cause or something underlying that's triggering that response in our body. But with anxiety, or if it crosses over into an anxiety disorder, there may not necessarily be a trigger or something that's the underlying cause of it. Is that what you're trying to say?
Yeah, that's kind of what I'm trying to say.
And of course, with the Diagnostic and Statistical Manual, the DSM, there's anxiety disorders that are actually classified by certain criteria. So we're not getting into any of that today. That's for another day, another topic. But we're talking about general anxiety that all of us can experience on a daily, weekly, occasional basis. That's something that relates to all of us. We've all known feeling that sort of thing. Some of us a lot more than others, but anxiety and stress is something that we all can deal with and all experience in our lives. And that's what we're here to talk about today.
Yeah, so if you want to know more about just stress or anxiety in general, we can go more in depth in another video. Let us know in the comments. But we just want to give you 5 very simple tips that you can start using right now to help manage stress and anxiety. So tip number 1 is expressive writing. So this technique is one of my favorites. It was developed by James Pennebaker. He's a social psychologist. And essentially, it is what it sounds like. You spend a certain amount of time, Dr. Pennebaker recommends about 20 minutes a day, where you just write out everything that's on your mind. Okay, so you're writing for yourself only. You're not paying attention to grammar, you're not paying attention to spelling or even making coherent sentences. It's just getting everything out. And so what I've noticed a lot with clients and students I've used this technique with is they feel a lot better afterwards because they're walking around throughout the whole day carrying all of this weight on their shoulders because of their thoughts. So this is sort of a release of those thoughts. What also is helpful about it is it's kind of a way to get that out in a confidential manner. So I know some people are afraid of others finding what they've written down. It can be very private, so I definitely recommend shredding that if you are kind of nervous about that, or getting an app where you can secure that information. I do want to warn you though, some people that have tried this technique might feel a little off afterwards, and that's normal because if you're a person that's used to just kind of putting your thoughts on the back burner, not confronting what's on your mind, it might be a new experience, but that should go away within about an hour, according to Dr. Pennebaker. And then the more you do it, the more you practice it, the more that feeling will go away. So 20 minutes sounds a lot. It's beneficial if you even do 3 to 5 minutes a day. So very, very powerful technique that I highly recommend.
Mari, can I ask you a question about
Sure.
that? So I've heard the term like brain dumping.
Yeah.
Is that something similar to this?
Yeah, so brain dump, mind dump, whatever you want to call it. I think I've heard expressive writing. So it can go by many different terms. And this is something that all of these techniques that we're giving you have been researched. They have been used with an assortment of clients, for example, PTSD clients, also students facing test anxiety. This is something you can do right before an exam or while you're studying, because it's very important if you're highly stressed out to get yourself in a state of calm. This might not be the best technique for everyone, but Sally's going to go into a technique that can definitely help put you in a state of calm a little bit easier.
So Yeah, thank you, Mark, for sharing that wonderful tip. And I actually also recommend to my patients keeping a notebook or journal, some piece of paper and a pen or pencil right by their bed before they go to bed, especially if they worry a lot, and writing down things, thoughts before they go to sleep that help kind of clear your mind. And so you're not worrying and thinking about it over and over, and you have it right there so you can get it out. It's on paper, you can let it go and just kind of get to sleep. And patients have given me feedback that was helpful, and I do it myself too. So having that notebook is handy. So the next tip number 2 that we're going to talk about is deep breathing. So deep breathing, back to that 2 nervous systems that we're not really aware of as part of the autonomic or automatic nervous system, things that are going on without our mind conscious control. So deep breathing, when you breathe deeply, and I'm talking about using your belly and your diaphragm, what you're doing when you're taking very slow and deep breaths is you're activating part of that parasympathetic nervous system. So that works opposite of the sympathetic nervous system. So the sympathetic, that's the go, run or hide, that's the fight or flight response, the alarm system. So there's one that works opposite to that to counterbalance it and kind of slow things down. It's also known as the rest and digest, because it works on digestion. When you eat something, you're not thinking in my stomach, okay, now my stomach's gonna let the acid be produced and digest it. No, that all happens after you chew your food. That's and swallow, that stuff takes care of itself. And so when we can actually use our conscious mind to take back control of that unconscious nervous system and activate it. And deep breathing is a really excellent way to do that because it works almost immediately. And when I say deep breathing, I'm not just saying, but actually, bringing into your awareness to pay attention and breathe in through your nose. I want and you can do this at home right now, but take in a deep breath in through the nostrils, in through the nose. And I want you to inhale over about 5 seconds. So breathing in through the nose, and then I want you to hold it here where you can feel it. Hold it right in that abdomen for 3 seconds, and then breathe out slowly through your mouth, but with your lips kind of pursed, like whistling, but lips pursed, and breathe out slowly over 5 seconds. So that's also known as 5-3-5 breathing, which is a deep breathing technique, which is effective. And you can count in your head. It's probably easier to do it that way than breathing and counting at the same time. But I'm going to count out loud for you. So let's try that right now. You want to do that, Mari, with me? All right.
Let's do it.
All right, let's go. So, all right, start with 1 deep breath in through the nose, and I'll count it. So, ready? All right, go. Deep breath in. 1, 2, 3, 4, 5. Good. And now I want you to hold it for 1, 2, 3, and then breathe out. 1, 2, 3, 4, 5. Very good. You can do another one. Let's do another one. In through the nose. 1, 2, 3, 4, 5. Good. Hold it there. 1, 2, 3. Another deep breath out. 1, 2, 3, 4, 5. So good. That's 5, 3, 5. You breathe in for 5 seconds. Hold it for 3 seconds. Breathe out for 5 seconds. How do you feel?
Yeah, I feel great. Definitely a lot more calm. And like I was saying earlier, it's really important if you are highly stressed out. So for example, if you're a student that's studying or about to take an exam, it's important that you take a moment to do some sort of technique to get yourself in that state of calm. And deep breathing can definitely do that. Physiologically, it's about impossible to be highly stressed out and highly calm at the same time. So the deep breathing can do that for you. It's a wonderful technique.
Oh yeah, and you can do that, any time. I recommend to my patients, I recommend doing it at least 3 to 5 times a day and doing 3 to 5 breaths each time. So there's more of that 5 to 5. And go for it. I'd say go 5. If you can do it 5 times a day, 5 breaths, and just see how you feel after, because it really does work. And back to that parasympathetic nervous system. So that's the rest, digest. That's the one that slows you down, keeps you nice and calm. And that's because there's a nerve called the vagus nerve, cranial nerve number 10 out there, for those of you who are anatomy fans. Cranial nerve number 10, and that's part of the digestive system. It starts right in the brainstem, goes down through the neck, and then it goes down through the chest, also known as the thorax. And there's holes in the diaphragm that it runs through and into the digestive organs. So, and when you're taking those deep breaths with the diaphragm, those belly breaths, you're actually stimulating that vagus nerve, and you're stimulating that parasympathetic nervous system. That's that rest and digest, that calming. So doing those deep breaths, that's the science behind it. That's really how it works, and it does. So just, you might even feel a little lightheaded after doing these sort of deep breaths. That's normal because it does lower blood pressure. It lowers your heart rate a little bit. So be careful. Don't, I wouldn't recommend doing this while driving or doing this if you're working, in heights or somewhere. But you want to be in a safe, quiet place if you can, or somewhere where you're not, operating heavy machinery or putting yourself or others at risk. But it really, does help and can help produce that sense of calmness, that sense of well-being, and reducing that stress and anxiety levels. So,
simple, it's free.
Yeah, and you can start doing that one right away, right now.
So we could go on and on about that, but we'll just move on to tip number 3, which is be in the present moment. So in other words, practicing mindfulness. So if you think about it, all throughout the day, most of us are constantly connected or multitasking in some sort of way. So we have our cell phones, we're constantly in our heads, but practicing mindfulness is a way to get us outside of our heads and be focused on something outside of ourselves. So stress definitely did evolve. It served an evolutionary purpose for us to deal with perceived threats. Nowadays, at least in the industrial world, our perceived threats usually are not the same as they were. So for example, your test is not going to kill you like a bear that might be running out to get you. So what I'm trying to say with this is being mindful can put you in that present moment where stress and anxiety a lot of times is in the present, like in the future. It's in the future, our perceived threats that may or may not happen. So examples of practicing mindfulness could be just something as simple as when you're eating your food, sit with your food and use all of your senses. So smell your food, actually taste your food, chew your food, instead of sitting in front of the TV or on your cell phone while you're eating. So take that time to appreciate it. Another easy technique to use is kind of when you're just talking and engaging with someone. Instead of thinking about what you want to say next, actually practice listening to that person, being engaged with them, giving them your full and undivided attention is a great way to practice mindfulness. Even doing a hobby is a great technique. So if you have a hobby that maybe you've used where time kind of stops. So for me, that would be drawing. Like I could draw for hours and not know how much time has lapsed. That brings me a lot of joy, or it has in the past. I have to get back to that, but drawing can be great. Coloring is a great technique. So of course the adult coloring books are very popular. And the reason for that is because you really have to concentrate and be in the present moment to make sure that you're coloring inside of the lines. So, you can't be watching TV or doing 100 other things while you're coloring, at least if you want it to look nice. So those are a few techniques that I have to do in the present moment, but I think just with practice, the more you practice being mindful, the easier it does get over time. Yeah.
Great tips. Yeah. Mindfulness.
Yes.
You're gonna have to try that. Me, I'm all over the place, so.
Yeah, same.
Yeah. But yeah, taking a second, time, just to be present, can really, definitely help lower stress levels. So let's move on to tip number 4 then.
Yeah.
So tip number 4 is using oxytocin. So oxytocin is also known as the love hormone. It's one of those chemicals in the brain. It's produced by the hypothalamus, and it's stored in the posterior pituitary. And it's famous for childbirth and stimulating contractions. A lot of people know it for that, and also for nursing and lactation. But also, it's very important too for pair bonding, for social feelings of belonging and socializing, and also it can be also released through simple acts of just touching, holding hands, massage, petting if you have furry friends, petting your dog or cat, or iguana, whatever pets you have at home.
Even yourself.
Even yourself, yep. Self hugs. This actually does, stimulate oxytocin. So, getting your oxytocin levels flowing is another way that can help naturally reduce stress, because oxytocin has been found through laboratory studies and different research out there to actually have antidepressant-like effects in the brain, which is pretty amazing.
Yeah.
And there's lots of natural ways to boost your oxytocin levels, and touching, just self-touching can stimulate it. So another thing you can do, instantly. And also too, it kind of goes with that mindfulness, because it helps bring you back to feel the sensation, to be present in the moment right now. And just to touch back on the mindfulness thing, there's this Eastern philosophy that depression comes from spending a lot of time or too much time thinking about the past, and anxiety has to do with thinking too much about the future and worrying a lot about the future. And then happiness and peace and calm comes from being present in the moment right now.
Yeah. Eckhart Tolle's book, The Power of Now, is amazing. I highly recommend it. Yeah.
So just being here right now in this moment. And that's another, back to the breathing. The breathing helps bring us back into the moment. The touching, grounding. There's techniques called grounding, which are very good for anxiety as well, especially for people with panic attacks who suffer from panic attacks. So we can do another video talking about those, other types of grounding techniques, or do a grounding video if anyone would be interested in that. But I think Amari has one more tip for us.
Yeah. So just the last tip, what I talk about is awareness, having awareness about your thoughts. So according to CBT, cognitive behavioral therapy, our thoughts, our feelings, and our behaviors are all connected. So I like to use an example of, sorry, I have something in my eye here, of, again, a student studying for a test, because I do work a lot with college students. So, for example, if a student is really nervous about their math exam and thoughts are coming up while they're studying, I'm so terrible at math, I failed my last math exam, I'm going to fail this one. That thought can often lead the student to having feelings of just, high anxiety, maybe distress, and then that can lead that student to possibly procrastinate or not actually do the work. I see this a lot with students, and it's a primary reason why they procrastinate. It's just because they feel so overwhelmed. So with that, really all I think we can control is our perception of the situation. So a way of doing that is to change thought patterns. So for example, instead of the student saying, I'm so stressed out, I did terrible in math before, I'm going to do terrible again, maybe replacing it with an alternative positive thought, but still a thought that is realistic. So for them it might be, I am studying a lot more for this exam, I'm going to tutoring, I'm getting the help necessary, I'm meeting with a professor, I'm studying a lot differently, and because of that, I am going to do better on this exam. So a lot of times that can lead the student to feel maybe more motivated, and then that motivation can lead the student to actually take action and study a lot more productively. So again, this is a little easier said than done, and we can do maybe a full-length video on this, but just to gain awareness of what you're telling yourself, because our thoughts are so powerful. What I recommend for students and clients to do is maybe keep a thought log. So when there's a negative thought, write it down and then write an alternative, positive, but still realistic thought. And keep doing that. It might be a little difficult at first, especially because you're likely very deeply rooted in that negative thought pattern in your subconscious. Essentially what you're doing is you're changing your subconscious script through rerouting your thoughts. So this may take some time, but really what is important is being consistent. And I think consistency is key with all of these techniques. Definitely practicing stress management when you are stressed is great, but practicing some of these techniques on a daily basis can help with preventing too much chronic stress. Yeah.
Great stuff.
Yeah.
Very
So, anything else you want to add?
Yeah. The only other thing I was going to say is, someone once told me, something good that I heard was, asking yourself, what are those negative thoughts, doing for you? How are those negative thoughts serving you? And thinking about kind of like that, why am I having all these negative thoughts? Is there truth behind them? And really, analyzing and assessing and being, first being aware of them, but then thinking, why am I having these thoughts? Where are they coming from? Or how are they helping me? And if they're not helping me, learning different techniques to work on changing those thoughts or letting them go, so that we can talk more positively, more honestly, and more realistically to ourselves, to be, I think, to be more helpful, productive to our overall, well-being, especially our mental and physical well-being. Yeah. So, thanks for tuning in.
Yeah.
Those are just 5 tips we got for you. Things that we recommend and have worked for people out there, and I believe they can work for you. Just have to give them a try. And as we said in our first video, none of this constitutes any sort of medical or legal advice. You definitely want to talk with your doctor or your healthcare provider about any sort of things that you want to try. But these are just things that are out there that we know about and we wanted to share with you. So hopefully you found this video entertaining, helpful, interesting, and just comment below if you got anything or any feedback for us.
Yeah, we'd love to hear if you have any techniques that have worked for you, or if you've used any of these techniques that may be successful. Yeah. So, all right. Well, thank you for your time. Thanks for listening to us, and we'll see you in our next video.
Yep.
Bye.